Hi, everybody. I'm Tim Piccirillo, and I'm a professional speaker, trainer, and marketing consultant, and I am also a COVID survivor. I'm 60 years old. Thought I was in excellent health. I work out. I'm a workout guy. I eat healthy. My cardio was, very good. I walk when I do the power walking. That's part of one of my workouts. I walk with weights in my hand and do arm exercises at the same time. So, I'm not the picture of health, but I consider myself pretty healthy. And my COVID journey started on June 8th of this year, 2020, the year from hell. And it started with, I'm also a part-time entertainer, a comedy magician. I live in Tampa, Florida, or St. Pete, Florida, in the Tampa Bay area. They opened up the state, and I'd taken measures up to that point. I'd quarantined, wore the mask, social distanced. The only place I went every week was to the grocery store or to my chiropractor. And sometimes the grocery store was like 2 weeks. So people would ask me, how did you get this thing? I have no idea. It could have been at the birthday parties that I did. It could have been that I touched a canned good at the supermarket, wearing my mask, get back in the car, pull my mask down to drive home, and then scratch boom, I got it. So I ask that a lot. It's a crapshoot, whether you're gonna get this or not. You can take precautions, there's no getting around it. The mask, the social distancing, sterile, washing your hands, hand sanitizing, that will cut down your chances of getting it. I never thought I'd get it. I never thought I'd almost die of it, but I got it. And I was very close to, thank God for, I'll tell you, my treatment. So basically what happened was got this thing on June 8th. That's when symptoms started. I was extremely fatigued like I've never experienced before. Massive headache. Didn't have a sore throat, but had sinus with a drip, and I had a loose cough. And this continued for another week until that was on a Monday. The following Tuesday, I got to the point where I was so sick I really couldn't take care of myself, and I contacted 911. They took me to a local hospital where they gave me the battery of tests, including influenza, COVID-19, as well as the typical, heart stuff, everything. The influenza came up negative. Obviously, they wouldn't get the results of COVID. They said they'd call me if it was positive 2 days later. It takes 1 to 2 days. And they sent me home. They said, we could keep you here. I know you're sick, but you'll be more comfortable at home. I said, that's fine. So I went back home. And 2 days later, I wasn't feeling any better, and I got the diagnosis. They didn't call me, but I could go into a patient portal in this particular hospital and see my test results. And I was COVID-19 positive. That afternoon, I started having trouble. My breathing became real heavy. And I knew, it had gone to my lungs. So I knew this is a respiratory virus, SARS type virus. And so I called 911 again. The paramedics gave me a little pushback. They were different paramedics, but at this point, the surge wasn't starting where I live here in Florida, but it was starting to go up that way. So they were cautious. They wanted to take the most sick people, and I just kept telling them I can't take care of myself. I'm COVID positive, and they took me back to the same hospital, ER, and it was there that they did another chest X-ray, and I was diagnosed with with pneumonia by that time. It's just started. So I slept in the ER that night until about 3:30 in the morning, until they had a bed available in the COVID unit. And then they took me up there the next day, and I started escalating. My breathing was getting even more labored. I was feeling worse, if that was possible. Just in my particular circumstance, I've never been this sick in my life. I've never felt this sick. And like I said, this is 60 years of living. What they found, though, is that the underlying condition that I thought I'm in pretty good shape. My wind is good. My oxygenation to my brain always hovers around 96 to 98%. I had COPD. I had quit smoking 15 years ago, but was a 20 plus year smoker, and found out I'm COPD. Now the good news about it is the virus did not attack my lungs for about 10 days. So that told me that my lungs were still, strong, but not strong enough to fight this virus, right? So I do have low, in the low range of high blood pressure. It's a genetic thing. Both grandfathers have that. My father has it, so it's a genetic thing. Mine doesn't run real high, but I do take medication, my doctor said, primarily to protect my kidneys. So now I'm in the ER, and now I'm in the COVID unit, and I have a hospitalist there as my primary care physician. I also have a pulmonologist. The next day, my breathing gets heavy. That was about the only time I thought about death, because I know this thing kills people, and the fact that I was in an intensive care unit, I was very, very sick. And I thought, wow, okay, if it's my time, it's my time. Started talking to God, but amazingly, I astounded myself that I wasn't afraid of death. I always tell people when I got this thing, I wanted to either die or I wanted to get better, and I didn't care which at that point. But I was really at peace, just being in the hospital, feeling that I was cared for, whether I was going to go or not. I was at peace with it, the outcome. So my pulmonologist came in that day, and we talked, and he said, I'm going to start you on dexamethasone. Now, dexamethasone is a corticosteroid, and it's saving lives right now. And I remember the day after, I think this was the third day, because it's kind of foggy with me. The third day is when my breathing got worse. The second day, a friend of mine who owned a pub over in Central Florida where I used to live sent me an article about dexamethasone. Now, he is from the UK originally. He said, I've got a number of friends that got sick from this. Their doctor prescribed this and they got well. Well, it was really funny because he sent me an entire article on this, and the next day when my pulmonologist found out that I was having trouble breathing, he said, I'm going to start you on this steroid. It was the same thing, dexamethasone. And what this drug does is, for me, it was a lifesaver. Now, obviously, they did the Z-Pack, and they did another very strong antibiotic intravenously to take care of the pneumonia. But what this dexamethasone does is reduces the inflammation in your lungs so you can breathe easier. It also suppresses the immune system, because the immune system can go into hyperdrive, and if it goes that high, your immune system will actually start attacking your own cells in the body. It's kind of like lupus, if you know. It's not like lupus, but lupus is where the immune system starts attacking various major organs in the body. Well, mine was, that's why they gave the dexamethasone, and it evened it out, and so the antibiotics could work better, and I could breathe, which now my body hopefully would take care of the virus, which it did. I've been released now at this point for 2.5 weeks. My doc said that it's going to, I have caregivers following up with me by phone. My recovery has been slow so far, although I made great strides. The first week, it was just total fatigue. Now it's a day or two good, and I tire easily. I'm just happy to be alive. I'm just really glad to be alive. I'm asymptomatic now. I'm sure the antibodies are in my system. My doc said to just wait a month or so for your regular blood work to check for the antibodies, because a lot of COVID patients, she had told me, test, they do 2 or 3 tests and they still test positive. So we know I had it. I know I'm healing. I can tell the virus is out of my body. I did lose muscle mass. Like I said, I'm a workout guy, but I've lost muscle mass. I tire very easily, even mental. I haven't gone back to work. I could maybe work an hour a day, on client work. So my recovery has been a little, now I'm a workaholic and I'm going 100 miles an hour most days anyway. So this has been a really good thing to slow me down. And I've learned to listen to my body, and that was the biggest thing. You can't do what you used to do, Tim. You're 60 years old. You can't work as hard. It takes longer to heal. So you just got to listen to your body and do that. And that's what I do. So my recovery is coming along well. I will tell you a little bit about my mental health through this. Now, I made my living for a lot of years, for about 20 years, as a motivational speaker. Now, when you hear that, that's a misnomer, because nobody can really motivate anybody. All we do is set the conditions and give you examples of what's possible. We set up the possibilities and then let you determine for yourself. Well, where did this come from? Well, I started working on personal development back in the 80s and cultivated a positive attitude. I've gone through I have Tourette syndrome. You'll see tics, now it's coming out. Um, and there are co-occurring conditions with that, including anxiety. I had a full-blown generalized anxiety disorder. I've gone through battled depression because it's Tourette syndrome. It's not just the tics, right? And I thank God I don't have the vocalizations. Um, but I battled all this stuff and cultivated a positive attitude. Now, I'm not this guy that just looks at things through rose-colored glasses by any means. I just tend to see the glass. I'm a half full glass kind of guy. That's the bottom line. So that has kept me, like I said, I only thought literally about death one time in the hospital. And it didn't last that long, and I was at peace with it. Now you got to understand, I'm like everybody else. I'm not fearless. I am not this guy that doesn't have any insecurities, or I'm not afraid of it. No, I've got, I'm like anybody else. I got my fears, I got my insecurities, but for some reason, when you're flat on your back and you're kind of powerless over this disease, and you're facing a virus that even there's no cure for. The doctors are just trying to treat the symptoms. And hopefully treating the symptoms well enough so that your body can get rid of the virus. So for me, I recognized, I use another concept, I recognized years and years ago, it wasn't just a positive attitude, but I don't have control past the end of my nose. In other words, I can't control that virus, really, other than, keep my mind up and thinking healing, right? I can't control the doctors and what they're doing. All I can do is control my reaction. And so if I could keep that reaction in check and think in terms of positivity and healing, and that I'm well taken care of and it's going to be okay, that was huge. But here's one thing that I've learned, which I've known forever. And when you're flat on your back and you're facing possible death, you think about this. No man, and I don't know who said the quote, no man is an island. And what that means is I can't do life alone. I can't get through life alone. I can't do it by myself. I had support. My brother, Dave Piccirillo, was with me, even though he's 1,000 miles away in Pennsylvania. Every couple hours he would text me. He suffered right along with me. My elderly parents, 91 and 87, sharp as tacks. They're amazing. They were there with me too. On top of that, my Facebook community rallied around. They circled the wagons, and I had that emotional support, because a COVID patient, as you know, if they're in ICU or a COVID unit, no family members, you're there by yourself in an isolated room, and you have, your nurses and doctors come in full PPE, and it's just, you're on your own for the most part. So, but thank God for social media, and thank God for Facebook. I have my opinions about that too. I work online all day, every day. And, there's some downsides, but my peeps came and they were a huge support. People were messaging, and I had to tell them afterwards, like, please don't message or text. I'm just too weak to get back to you. So my support network was instrumental in my recovery. There's no getting around, just instrumental. I couldn't have done it without my friends and family. I just couldn't have done it without them. But one thing I do know is that it does have a low death rate, mortality rate. So you just got to keep your spirits up as best as you can. That's what I've learned. I learned a long time ago, a positive attitude will get me a hell of a lot farther than a negative attitude. So the last thing I want to talk about really is the government's response, because a lot of people want to know. I normally avoid politics because at this particular time in history, this country is divided. The only time I've seen it this divided was in 1968. I was only 8 years old, almost 9 at the time, and I remember it vividly. We were torn by the Vietnam War and race riots like are going on now, and the assassination of Martin Luther King and Bobby Kennedy. Just a huge, shift in time. This reminds me of it. Now, it's easy to point the finger of blame at the government. I'm not a Trump supporter. I'll be the first to admit it. I'm just not. I don't think he's good for the country. It's just my opinion. I didn't vote for him, would never vote for him. But on the other hand, I try not to make this political, because what I will give that administration is everybody's dealing with an unknown thing here. It's an unknown entity. We were woefully unprepared, and I won't point fingers because who knew it was coming? So everybody, I take the compassionate side that everybody does the best they can. That's what I firmly believe. So when you point the finger, now the one thing that I'm not happy about is that the president currently is downplaying this thing. He made a statement, just a stupid statement the other day about this thing will go away on its own. Really? Well, tell that to the people where it's surging, like in my state. And, I'm not happy about that because we opened way too soon. I knew that. Our governor made an egregious error that way. And a lot of people won't agree with me because they make this about rights, about don't tell me to wear a mask, don't tell me to social distance, how dare you shut down my business. And I get that, and it's all tied in together. You can't separate the economy, the loss of jobs, and coronavirus, the pandemic, because it is all tied together. And I said that since the outset. Where's the line, between shutting down businesses where the economic collapse happens, and then what happens? Well, people start stealing from each other, and then we have chaos and anarchy. Then they implement or institute martial law. I mean, that is a real possibility if things are shut down and money stops circulating. Now, I'm not trying to be a purveyor of doom. I'm a guy that thinks in terms of the possibilities and what good came out of this, because in every adversity, I've learned that there is usually a blessing and a lesson, usually several of them in each one. I'm using this time for a lot of different things. I'm writing an ebook on my experiences with COVID. I'll be putting out a course on how to overcome adversity, because I've had so much in my life, and I have actual techniques and things that I use to get through these things, and to get through them with a level, not just sanity, but peace. So I'll be doing that also. But overall, we're dealing with something that has just been unknown up until this point, and you can't really blame anybody. You can. I don't think downplaying it or opening too soon. I think we have to take precautions. But one thing that I do stress, I've become an activist with this thing, is personal responsibility. When people come to me or complain about masks, and I understand there's people with medical conditions that cannot wear a mask because it obstructs their breathing. That's different. But for the rest of us, how difficult is it to wear a mask, which they've shown cuts it down the transmission, right? So it's not about you. It's maybe, I had it and I was passing it around, right? So I'm really, passionate about that, as you can tell. It's not just about you. We're in this together. And when you're congregating, not wearing a mask, you don't know. This is one of the reasons it confounds scientists, because 20 to 40% of people that get this are asymptomatic. So they can't figure out. You get one of the nastiest viruses that have ever come out, and 20 to 40% that get it don't show symptoms. Some never do. So they don't know a lot about it. So I really can't point the finger of blame at anybody. What I don't like, again, is the downplaying of this. This is serious. This almost killed me. The numbers are surging all over the country, particularly in, my state, Texas, Arizona, California, huge epicenters. It's to be taken seriously. I've never been so sick. I'm lucky to be alive, and my recovery is slow, but at least I'm recovering. So I guess the message is, and this is a little bit long, I know, longer than most of the videos, take care of yourself. Adhere to the precautions. If you get this, yes, there's the spectrum. You got the mild cases and the severe cases. I was closer to the severe one. A lot of them are mild, but we've had two 11-year-olds last week in Florida, 11-year-old kids that died of this virus. Millennials are being affected. In my county alone, I believe the last stat was 20% of who's getting this are, millennials. And I've heard of, you know, 40, there's a Hollywood actor, or I mean, a Broadway actor. What was his name? Michael Cordero. I can't remember his first name. Just passed away, 41 years old, great health. And he went in, you know, he had to be intubated pretty quickly, and he just passed away. The people that are perfectly healthy that are getting this thing, that are just, you know, they're dying. Young people, you know. Then there's people like me that thought I was healthy, but I had underlying conditions that almost killed me. So, you know, my thing is take it seriously. It has been quite a journey. It's been a month now, a little over a month. We're going to get through it, but it's you have to take it serious. That's my message more than anything. It's not fun to go through, no matter what you have, and if you're, you know, fighting the precautions, think about your loved ones if you see them, because my family suffered right along with me, and so did a lot of my Facebook friends. So I hope this helps. I really do. I want to thank the COVID Survivors Project for inviting me to put this video on. I think what you folks are doing is just an amazing service to get the message about the seriousness of this out there. So thank you very much, and thank you all for watching.